A lot of people see, all the great things that we've been able to accomplish in these past 6 years, but it hasn't been easy.
When you're starting a business, there's no such thing as balance. If you want it to get off the ground and it's sink or swim time, you don't balance anything, you just do. But there have been a lot of learning opportunities along the way for us, and it's helped us build really kind of the practice of our dreams. My legacy, or our legacy, I hope, is to change people's lives for the better. We care about people and it shows. So great, so we'll just get this thing going. And so my name is Dr. Sean Lordan. I am the owner of Concierge PT and the founder of the PT's PT podcast. And today I've got Erson Religioso, physical therapist. Did I completely butcher your name, Erson?
Well, hey, you got their first name right, which is that's half the battle right there. I mean, I usually get Erson Religioso. Religioso would be okay if I was Italian, but I'm Filipino, so it's Spanish, so it's Religioso.
Okay, perfect. My wife is 50% Cuban, so I'll have to work on that pronunciation.
Yeah, you can tell her, hey, how would you pronounce this?
We're just gonna line up her family. I bet you her dad and her mama would definitely get it right, and then her mom would.
Oh, for sure.
I love you, Shawana, but you'd butcher it.
Yeah.
So you want to just just give the
audience go ahead. Yeah, no.
A little bit of history and just tell us a little bit about yourself.
Well, I've been a PT for 26 years now, which to me seems crazy because I don't know. I just can't believe I've been doing it that long. It doesn't feel like I've been doing it this long. So I graduated with a BS and MS from Duval College in Buffalo, New York. And at the time, it's funny because it was one of the few master's programs between 93 and 98. There's a 5-year dual BS MS. And I remember meeting a lot of other student PTs and PTs at like APTA conferences and stuff. And I would always get the same kind of flack, like, oh, you're going for your master's? Why do you need your master's? Oh, I graduated and I didn't have to write a thesis. I'm like, well, good for you. I mean, why are you coming down on me for it? Like what kind of weird insecurity do you have that you're against us as a profession getting a more advanced degree, right? So then immediately upon graduating with my dual BS and MS, I heard about Stanley Paris's program, and initially I wanted to become a chiropractor, but to my parents who are traditional MDs, they basically said that they would disown me if I became a chiropractor. So one of my CIs had told me, have you ever heard of Stanley Paris? And I said, no, who's that? And he showed me his his page, one whole page in an APTA journal. And he had this new DPT program. Before transitional DPT was even a term, it was a manual therapy residency DPT. So after I graduated on a Friday, and I had applied to that program the week I was graduating, and I got in, and I had 2 days off, and I started school again on Monday for my doctorate.
Wow.
Yeah, so that took me about another year and a half. I graduated, I think I was probably one of the first DPTs in New York. I had a specialization, manual therapy certification. Then I got manual therapy fellowship shortly after that because my mentor was Dr. Renshank. He was one of the few PTs, manual therapy fellows at the time who was McKenzie trained. So I got my McKenzie certification. Then I took all the Institute of Physical Art courses, all the David Butler courses, all the Mulligan courses, a bunch of extra neurodynamic pain science courses. And, I just tried to take as many courses as possible because my goal at the time was to kind of supplant all of the gurus. I wanted to become like the next big thing, the next guru. And I just thought when these guys die off, I want to replace all of them. I mean, like talk about having a big head. I thought I could replace every guru because I would take every single one of their courses. So that's how that eventually became what I now call the eclectic approach. And I have a much smaller head, but I still, retain all the stuff that I kind of learned. And every once in a while, I whip out something that I may have forgotten about or may have given up doing like 20 years ago. So I have a cash-based practice now in Buffalo. I was probably also one of the first PT influencers, again, before influencer was a term. I had a blog, themanualtherapist.com. That's kind of what put me on the map. It was initially, I initially did that because I invented this thing. I mean, they're all over the world now. the edge
Yeah.
mobility tool. It was originally called the fasciolator because jokingly, when I believed that you could break up fascia, I said that it was like the Terminator, like it was a device from the future that was going to come back and destroy your fascial adhesions to change the
Yeah.
future for the better. So the edge mobility tool came from Tim Flynn of Evidence in Motion. Originally, back when he was listening to my podcast, maybe following my blog or something. I don't know. It was pretty crazy time that all these people who I looked up to actually read and consumed my content. But they said, hey, we want to use your tool in our ISTM and dry needling courses, but you can't call it the fasciolator. You need to come up with something more professional. So I held a contest on Facebook, and among my followers said, "Hey, what do you think I should call this?" And someone said, "I think you should call it the Edge Tool. It goes in with like the eclectic approach and Dr. E, which I already had this whole e-branding thing going." So that's where the whole Edge Tool came from, and now the Edge Tool morphed into Edge Mobility System, which is probably like my prime source of income. Is my e-commerce store with a bunch of vetted products that are all kind of either white labeled or they, like in the Edge Tool case, was invented by me.
That's awesome. And remind me, we'll save some time at the end of this because I want you to be able to kind of talk about the programs that you offer as well because it's really neat. Talk to me about that curve. So I know that there's a name for this principle. It's just it's not on the tip of my tongue, but the curve of like from new grad to 3 years out of school to kind of hitting that peak of like, wow, I feel like I know it all. My head is huge, and then like kind of really starting to hit that trough again, and then the slow gradual peak up to knowledge. Talk to me about your
It's
journey through that kind of
it
principle, whatever it's
Yeah.
called.
I mean, I don't even know if it's a curve because it is quite a roll. It's more of like a roller coaster with lots of
Yeah.
ups and downs. I mean, the first 5 years, you go from that. I know there's like that psychological principle, but I don't think the psychological principle covers quite all of this because there's like that, what is it, like ignorant competence or something like that because you don't know how much you don't know. And then you have like the knowledgeable, competent, knowledgeable incompetence. And I know that I'm mixing up the words, but it's something like that because then you know how much you don't know. Then you have like um, whatever competent competence, and then unconscious competence because then you don't have to practice, you don't have to think about it to have that mastery. It's when you obtain mastery. So the problem with that as those four levels is that I thought I hit level four like 2 years into my career. Like I had this amazing mentor. I studied from under Stanley Paris. I thought I had like, I mean, I did have amazing hands. I just was very adept at spinal manipulation. I could get like, I picked up cervical manipulation faster than a lot of my peers. I was able to teach it very well. I got people better. I noticed that I was getting people better that other PTs couldn't get better. And maybe it was also just because I was spending time with them, and a lot of PT clinics in the area are mills. Um, so for the first 5 years and the more courses I took, the bigger my head got. I'm just amassing all these tools. Somehow I have this tool bag and I'm a master of all the tools. Like that's not possible, right? You can't be the master of all. I was master of all trades, within those first 5 years. I'm not exactly sure what happened. I think maybe taking a David Butler pain science course was probably one of the first things that made me kind of question, like, oh, this is new. Like, this is honestly new. But that was really only in 2002. That was like shortly after I graduated, 4 years after I graduated. So that kind of made me rethink things, but I still thought I knew everything. But when I started blogging, if you look at like the first year of my posts on emmanueltherapist.com, I never took down anything other than posts that maybe I was asked to take down or posts of a course that I reviewed, like PRI that I initially reviewed favorably. And then I'm like, now I think that's nuts. So I'm going to take these favorable reviews down without actually publicly slamming them like I just did. Um, I think some of that is warranted, though. That's a rather crazy rabbit hole. I don't know if you ever got into that, but anyway, um, the first year
Yeah.
of my posts is basically like me, showing people I'm using this sedge tool. I'm like beating the tar out of people. I'm taking pictures of bruised IT bands. I'm like, now this marathoner can run. Uh, And after gaining notoriety, at around that time of like when I was starting to peak in social media, because again, there's no one else out there. It's like me, Charlie Weingroff, Julie Weed, Aaron LeBauer, Ben Fung, Mike Reinold, of course, and like that's it. Like it wasn't hard to blow up when when everyone was hungry for consuming content and there wasn't a lot of content there. Not like I didn't have great content, but it helped that we had this closely knit group of followers, and like Mike Reinold and Charlie were gracious enough to eventually share my stuff. Um, so after gaining notoriety, there's a group called Soma Simple who it's funny because I traveled all around the world teaching courses, and everywhere I went, people were like, "Oh man, I hate Soma Simple," because they just went about it the wrong way. They would invade your blog, they would invade your Facebook page, and basically say like, "Hey man, you're a dinosaur. You're holding back the profession. Your beliefs are all wrong." And naturally, you go through cognitive dissonance. Like, I was like, "What are you talking about? I'm successful. I'm whatever. I get people better." And the way they went about it, which is true, which is what I say now too, is we're not questioning your success because obviously you're successful, right? Except for I feel like they would say it in a patronizing manner. We're not questioning your success. We're just questioning the mechanisms at which you believe your success comes from. And that's so I lead with that as opposed to the "you're a dinosaur" thing, because I think I have the same exact message. So I go through all this cognitive dissonance and I'm like, you know, staying up to like 1 a.m., like furiously typing at the keyboard, arguing with these people who I think are trolls, but they're actually right. And then something kind of, I don't know what happened. I basically started looking at the research they were citing critically and saying you can't break up fascia and all this stuff is neurophysiologic. We don't really know why any of this stuff happens. Manual therapy is non-specific. That was really hard for me to admit, being a manual therapy fellow who taught in 3 fellowship programs, taught in 3 PT programs. Basically, everything you're teaching is wrong, essentially. And I was like, oh man, I think it is wrong. It's wrong. And then I had to adjust the way I explain things to patients, and that really made me question things. So I did all that, and I started launching. I started getting more and more courses. I had to kind of like adjust what I was teaching in courses. I was adjusting what teaching in school. The more popular my courses got, I eventually left. Part-time teaching because I just didn't have time for that. I only had time to do so much. Plus, I made a lot more money teaching courses. Um, but yeah, I had to kind of publicly admit after gaining notoriety, after being popular, that I think this is why we don't really know. We know why all this stuff works. We know the stuff works for outcomes. We know it works to improve pain. We know it works to improve function. We don't know why. We still don't know why, really. I mean, non-specific. I mean, there's Chad Cook has some great studies about certain neurochemicals getting released, but I mean, essentially, it's not for mechanical reasons. And if it was for mechanical reasons, all my explanations and courses would be so simple. I wouldn't have to like deprogram patients for the first half of their hour visit, about all their maladaptive beliefs that you don't have to foam roll, you don't have to static stretch, you can't break up fascia. Like you can use that massage gun, but you don't need to use it on like level 100, for like 30 minutes. You don't need to foam roll in the recovery pit after working out for like 50 minutes. I see people like foam roll while they're on TikTok, like longer than they actually worked out. So I have to like deprogram all these maladaptive beliefs. So then, getting back to that, well, now I think I know what's going on. And also I changed my message about I'm going to try to empower the patient as much as possible. The more I empowered the patient and actually adapted a lot of those McKenzie principles that I learned so long ago. Because when I got certified in McKenzie in 2004, I told the instructor day one, I'm only doing this to get the credentials. I don't even think I'm going to use it. I just want the credentials. And it's like, what a jerk, right? But then when I started adopting more of those principles, plus the pain science principles, and using manual therapy in the background, more of like to get people to the active strategy so they could be reliant on themselves and not me, my outcomes improved even more. So then I thought like, well, I really know what's going on. But then of course, there's always like the 20% I call it, the 20% of people you can't help, and you think like, well, maybe I need to learn dry needling. Maybe I need to learn nutrition. Maybe I need to learn how to blow up a balloon in a 90-90 position and all that crazy stuff, right? Maybe I need to learn more about mindfulness. Maybe I need to learn different nutritional concepts. Maybe I need to go plant-based and tell my patients to go plant-based. Maybe I need to learn about overbreathing and breathing concepts. So these are all the tangents that I've went on to try to help that last 20%. And every single time I thought like this is going to be the thing that is going to help me get that last 20%, I still hit a wall, you know? And so now it's funny, 26 years in, I believe that I can help most people, but I will never have, I think I will never have, because it was like a very false sense of confidence. I'll never have that confidence that I had during the first 5 years of my career, where I thought I could get every single person better if only I had the right technique. You know, and when I talk to other clinicians who've been on a similar ride, we all have that similar kind of, I don't even know what to call it. It's I just wish I could bottle some of that confidence, because I've lost some people when they're like, well, are you sure you can get me better? And I'm like, well, do I lie, or do, 80%, right? Do I mean, if it's like an ankle sprain, I'm like, yeah, sure, I can get you better. But sometimes I'm honestly not entirely sure, especially if like, and I tell them that too, like, well, a lot of my findings are inconclusive, but let's start with this, right? Some people appreciate that honesty, and other people have like literally never come back again and left me a bad review, So that's where I am right now. I mean, I think I can honestly help a lot of people who other PTs can't help. And if this is the PT's PT podcast, a lot of the patients that I see, especially virtually, are PTs who couldn't help themselves, and no one they know could help them. So then they reach out to me. And can I help the majority of them? I can help the majority of them, but I can't help them all. Some of them have
That's
gone
really
for
cool.
surgery too. Yeah.
Yeah, when I obviously consumed a lot of your content as well, and I love that you're not afraid to refer out, and I feel as though and I heard you were talking to somebody who said like I thought that I failed if I had to refer out, and I feel like I don't know where we get that as professionals, Erson, but it came somewhere in my in my training too. It's just we were never really taught to refer out, because we were taught that we could fix everybody, and the truth is you're exactly right. Like you can't fix everybody. So, you know, what's powerful, you know, in group practices, you kind of get different eyes, you can kind of get different eyes on the person. And I'm sure they're not as experienced as your eyes are, but sometimes it just helps that person with that different like experience or different, just different view of like, hey, maybe they took that PRI course and the McKenzie course or that other course that I didn't take, or you know what I mean? It's just like kind of get multiple eyes on bodies. And then if two or three people agree, like, hey, there's nothing we can do, like I think that there's a lot of power in that. Tell me
Yeah.
about
I have a story. I have a story actually about that. A
yeah.
very humbling story. Yeah. I worked, the guy who told me about Stanley Paris, who was my former CI, he eventually became a business partner. Um, After I had left the clinic and I went to go form my own practice, he's like, look, I just opened up a practice and I can't afford to pay you because I don't have much income coming in, but I'll pay you per patient. And now, you can just bring your own patients and have your business in my business. So his name was Dr. Terry Rose, and his practice no longer actually exists in this area, but I think he just opened up a different practice with someone else. But anyway, he's what I always refer to as the one of the best concierge type personalities I've ever encountered. Like he just, even his wife had always said, like the rules don't apply to Terry. He just like kind of does whatever he wants, says whatever he wants. The stories that he tells patients about him getting like drunk or whatever, you know, coming home drunk. Like I could never tell a patient that and have them laugh. They'd be like, man, this guy's so professional. For some reason, this guy just has this like totally unassuming, disarming personality that everyone just loves, He was never big into pain science. He just kind of did like he loved a lot of Stu McGill stuff. I'm not a big fan of like, like whatever, the same big three exercises.
Yeah. What is it? Cat cow, prayer stretch, and like
It's like
bird dogs or something.
bird dog, side plank, and hip hinge. I don't
Yes.
know, something
Yeah.
like that. So
Yeah.
anyway,
The big four.
yeah. So he was just getting into that. I was seeing one of my students' mothers. The student herself, I got better, no problem. So the student obviously trusts me enough to see her mom. Her mom, I thought I would just hit a home run with. It just seemed like she'd get better with simple manual therapy and lumbar side glide and just avoidance of the things that are irritating your system. She didn't really respond, and I'm not quite sure if she was really doing the exercises or not. Then I went away on vacation, put her on Terry's schedule. I come back and again, rules don't apply to Terry. He's one of those people with like great outcomes, great personality, terrible paperwork. Like I'm like, oh, what did he do? Like it basically is like a bunch of dittos for like on the exercise sheet. Like I don't exactly know what he did. She shows me she's doing she's like, oh, I'm so much better after seeing Terry. She's literally doing bird dogs. And I'm like, what? You know, like what it and I was like, oh, so what did Terry show you? And she's like, oh, well, you didn't read the records. And I'm so what am I gonna say? Like, oh, his records are crap? Because I thought that maybe she would just tell me. Well, she's like, oh,
Right.
show me this and show me this, and it made me better. So, but she wanted to know like she wanted me to like progress on exactly what he showed her, and I had no idea what he showed her. And this is a guy again who like would see three, even in our one-on-one clinic, he's almost seeing three people at once because if someone came the wrong day, someone came in an hour early, and someone came on time, he would see them all at once, and they would just have to wait. And for some reason, they didn't care. My patients cared if they waited, like 5, 10 minutes for me, because that's the precedence that I set that I'm never going to be late. His patient's kind of like, oh, he'll get around to me in 2 hours and I'll still have a good experience. So, like she stayed with me like another maybe one visit, and she just got so she got so upset at me that I didn't know what he showed her, and or which in her mind meant I didn't know what I was doing. When in the meantime, I'm just covering for him because his
Yeah.
paperwork was so bad. And then like I would just come in, twice a week. She'd be there twice a week for like the next month, doing like doing bird dogs, doing like all this independent stuff, and insisting that she got better. And I'm not exactly sure why she got better, but whatever it is about my exercises, she did not like. But she loved whatever he was giving her, even though he wasn't with her. Like I was with her 100% of the time, and he was with her barely any of the time. But she loved his exercises. She loved his personality, and it was so humbling for me because I just thought it would be so easy. And plus it was like my student's mom. And then I'm like, does this student even like me now? Because her mom clearly hates me. Like
Yeah.
I would come
She
in,
doesn't respect me anymore. Yeah.
I would come in and this woman would just glare at me. She would just glare at me. Like she wouldn't even say hi. And I was like, oh man, this is brutal. Brutal.
So that's definitely, I'm sure, a humbling experience. But tell me something, Erson, that you would love to have told yourself when you just graduated. Like if you were to go back and take, a time machine back to when you were 23, 24, just finishing up that DPT, what's like the number one piece of advice that you would give yourself?
I would say don't be in a rush. Your experience does not trump your knowledge. Because I thought that my knowledge would trump experience. And in the middle of my shortly into my DPT program, my roommate and I, who also like he graduated and he went right to the DPT program. But after the DPT program, when I started working, he went right to chiropractic school and did 4 more years.
Oh my
Um,
God.
so
Could have been a surgeon.
someone in one of the courses said like, "Oh, you guys had just graduated." And she took out this piece of paper and she's like, "This is how much you know." And she drew like a little like if this is ever expanding knowledge, she drew like a small, like swirl. And she's like, "This is how much you think you know. This is a piece of paper, and this is how much you know." And I was like, "What do you know, lady? You know how many courses I've taken? You know?" Um, and it's funny. I had also been told a CI even told me once that she wrote that because I wasn't asking her any questions because I had taken like the equivalent of Mackenzie AB because of my instructor had we had like two which was unheard of at the time. We had 5 credit ortho 2 semesters. At the time, there was usually the entire PT program, a bachelor's program, had 1 3 credit ortho. We had 10 credits of ortho. So we had the equivalent of like a lot of manual therapy courses mixed in with Mackenzie. So my one CI is like, oh yeah, I'm like I just took Mackenzie and I'm like I already know more than her. So I didn't really feel like I could ask her any questions ignorantly. And on I remember my first 4 week eval out of an 8 week clinical, she wrote, Erson's confidence outweighs his ability to treat patients.
Wow. That couldn't have felt great.
So no, and in order to pass, I basically just asked her the dumbest questions, like, oh, hey, how hot is this hydrocculator? Or what should I set this ultrasound to? Or am I doing this right? Even though I felt like I knew the answers, and I'm pretty sure I knew the answers. I was a good student. I would like to go back and tell me of that era that you honestly don't know everything you think you know, and even of all your knowledge, and I shouldn't say like your knowledge is great, but your experience is not, and that's the thing.
Yeah, I mean, it's just like how many times in your career have you seen people get better from things that like you didn't even think that were going to help them, or like they got worse from simple things that you thought were going to help. And it really is just like how many bodies have you seen, and how many, I mean, you just spoke about the tangents earlier, like like you could go off on a trillion different tangents as to like you know what could help somebody. And I don't know if you watched this on Netflix, but there was recently this documentary on like gut health and your microbiome, and how literally they would basically supplant one person's microbiome to another, and they would literally manifest all of that person's symptoms, depression,
Yeah, yeah, that's
metabolism,
nuts. I've seen that before
incredible
too.
stuff, with
Yeah,
fraternal twins or biological, identical twins. And so it's just like, I love that you would go back and tell that version of Erson, like, hey man, like you just haven't seen anything yet. Like you could be the smartest book smart person in the world, but like you're not even close.
yeah. The funny thing is though, that version of me is also like in much better shape. That's like back when I had like a six pack and everything, and I just like worked out so hard, and I probably like either beat myself up or like, man, I turned into a slob.
Oh, do you have kids?
I do, yeah. It's like I have six kids, and it's funny. Like every kid I had, I would always say it's like one less visible ab. Now I have six.
Yeah, yeah, yeah. So I've got two little girls. So I don't know. I think that the six pack is just completely out of the question when, the
Well, I mean, my wife
Crustables on
still
the
thinks I'm
table. I'm
attractive.
eating it.
Yeah, exactly. My wife's a great cook. Even like the best thing about having girls is like my two of my girls are amazing bakers. They're like teenagers. What? I mean, I'm just gonna eat like, oh, you made cookies? I'm gonna eat cookies now. Like I'm already married to someone who thinks I'm good looking. She's beautiful. What more? I mean, who do I have to impress now? I'm healthy enough. I can still run and rock climb and everything, and I just don't look like I used to.
Yeah. So I love that. So we've got about 5 minutes left, Erson, and I've got two more big
Yeah.
questions. So my first question is, talk to me about, one time you failed or a big failure that you had to overcome, and how did that go? And then we'll get into the next one. Then we can talk about your programs.
Yeah, well, I mean, this goes back to experience. So I had never failed a major practical or anything in my life, and culminating my DPT, you had to pass the manual therapy certification, which apparently, when the University of St. Augustine kind of looked back on their data, the students who they gave their whole curriculum to, like in their entry level students or the DPT students, they would always fail versus experienced clinicians would pass. And they realized that you needed experience to pass all of these questions because it wasn't just demonstrate the techniques. I certainly knew the techniques, I knew the anatomy, and I knew the arthrokinematic. But when they asked certain questions about like some condition I'd never heard before, what would you do? I didn't pass. I did not pass my manual therapy certification exam, and I had never failed anything like that before. Um, and again, it was because I didn't have the experience, but I had the knowledge. So if there's a recurring theme to today's podcast is you can't rush experience, right? So I had to like just mull on that, and I studied so much. And only 3 months later, I basically studied. I didn't fail the whole thing outright, but there were certain questions that I just didn't know, and it was actually somehow I'd never heard of IT band syndrome or something. Like it was something ridiculous like that, like something that I can't believe I never heard of, but we didn't go over in ortho or something like that. Or hip bursitis. I mean, it's something ridiculous. But I knew that so I just studied that, and I just studied a bunch of techniques around it because all they wanted to know was what techniques you would do around it. I should have just known enough at the time. They wanted me to do some kind of IT band release, or, like a lateral hip release, and all this soft tissue work followed by joint work, which is kind of like Paris's thing: soft tissue work, then joint work, then exercise, right? So I mean, it's not like I gained a ton of experience in 3 months, but I was able to pass with flying colors the two sections that I did not pass. So
But I mean, and look how you've evolved. You're one, probably, you're a premier manual therapist in the United States, if not in the world, and you failed your manual therapy certification the first time. Think about
yes,
that. I mean,
my mentor told
so
me
for
too. My
anybody
mentor told
listening,
me too. It happened to him, and he's like, I didn't want to tell you until after you failed. But he's like, I failed my manual therapy certification exam too, and that's when he said that everyone passes these. Just it might not be the first time.
yeah, it's incredible. I mean, how powerful is that? Talk to me about, your favorite Con Ed course that you've ever taken, and then I want you to talk about your Con Ed courses and that
The
sort of thing.
favorite course I've ever taken. Wow, I mean, probably Eddie McKenzie course with Dana Green, because he is an amazing instructor. He's so charismatic. He's hilarious. I hope that I am like a tenth of an instructor as him. Also, Lori Hartman, who used to be like the premier osteopath. Like, this guy was so great at manipulation. And again, manipulation is not something, if I manipulate people twice a month, that'll be a lot, even though I teach it in courses, so I might actually use the techniques more than I use it in my clinic. Um, but this guy was so great at manipulation that Stanley Paris, Oleg Grimsby, Mike Rogers, like all these opposing kind of like opposite commercial models who are all kind of like founding fathers of the AOMPT, they would say like, well, we're going to certify you, you get certified by us, and then we're going to bring in this guy independently of us to clean you up. Like, his technique is so good, we think he's better than all of us. So even though we all have like these, competing programs, we all agree that this guy is amazing, and he was amazing. I mean, just the best hands ever I felt in the world. Um, so I love those courses. I also loved SFMA with oh man, the guy who teaches at Belmont. He was just like such a character. Like a I forget his name, but even though, so these are all things that I dabble, like I take the best
Yeah.
of all these things, which leads me up to my modern manual therapy and eclectic approach courses. It's like I no longer believe, like I believed at the time, that you need to have a lot of minutia. I know minutia sells. You don't need 8 levels of courses to get the same guru-like results. Like, anyone can get guru-like results. And in fact, I no longer think I'm a guru. The only thing I think that I may have over anyone else, I tell some of my classes, is I have my mouth. I have like my Jedi mind tricks. I'm able to explain things to patients in a way to get them to be compliant. I'm able to maybe argue with them or debate them, get rid of their maladaptive beliefs, because I've really worked hard on my patient explanation, and I really am a strong believer in therapeutic alliance. Of an hour visit, it might be like 45 minutes of education, 5 to 7 minutes of manual therapy, and then the rest I'm spending on what I call the recovery plan. So, my modern manual therapy courses, especially my upper and lower quarter, that's basically what I feel like it will teach you how to treat almost everything. And my goal is not to replace what you're currently doing. It's not to replace all of your techniques, it's just to enhance it. If you're already a great clinician, but your visit average is maybe 8 to 10 visits, I feel like I can cut it down to at least 6.
Yeah, I think that's awesome. Closing tradition, favorite concert?
Oh man, gosh, so long ago. I don't go to concerts anymore. I mean, I saw a great Tom Petty concert. Dave Matthews once in Buffalo, New York. It's funny, Nora Jones. Nora Jones? Is Nora Jones?
Yeah,
Yeah, Nora Jones, right? Like,
yeah,
she the singer, like a kind of.
I think
Anyway,
so.
she
Yeah,
opened.
she's like a
Yeah, yeah, she opened for Dave Matthews, right? No one had ever heard of her at the time. She sang like 5 songs, and other than the Dave Matthews concert being really great, might have been Dave Matthews and Tim Reynolds. Um, someone yelled like drunkenly behind me, "That was a great song!" And that was actually like the favorite like trashing thing that anyone has ever ever heard anyone say to any performer, because it's so true. Like, if you listen to like 2 of her albums, they all sound like the same song.
yeah. I love that. What does it mean to be a great PT?
Oh, to be a great PT, I think you just need to be a great listener. You need to be able to motivate the patient to be independent of you. You need to make it so that it is not about you, it is about them. And Modern Pain, Mark Cogella came on my podcast and basically said that, both he and I, we used to think that we were both Batman, but we're really the Alfred. We're really the man in the chair. You're not going to be the patient's hero. You're going to be their guide to recovery, right? So you got to be their Alfred, not their Batman.
I love that. 4 words, mantra for your life.
Oh man, praise be Lord Jesus Christ.
Love that. Love that. Erson, thanks so much for joining me today, and really appreciate your time. And this was great. Thank you so much.
Yeah, we got a swell podcast.
Would love to. Just let me know
All right.
anytime.
Okay.
Awesome. Thanks, Erson. This is
All right,
great.
see ya.